Welcome to Aging Insight with your host, John Ross and Lisa Schollmeyer. This program is made possible by
Welcome to Aging Insight. I'm Lisa Schollmeyer, and I'm here with John Ross. And you are watching one of the programs in the Arklatex that is the best source for information for you as a senior, for you if you plan to be a senior someday, or families that are helping and caring for a senior member of their family. That's what Aging Insight is about, is to educate and inform so that you can, live your best life.
That's right. We want to try to make sure you've got the information you need as you navigate through these senior years, because something about this time frame in life where all of a sudden you have this avalanche of different laws that start piling down on top of you, and all of a sudden you have wills and trusts and guardianships and powers of attorney, but you also have tax issues and real estate issues and family law issues, and you have government regulations and Medicare and Medicaid and Social Security and veterans benefits, and all of this stuff is just piling on top of you one after another. And if you don't know how to sift through that pile, you can end up making a mistake in all of this. And Lisa, I would say about half of our business is preventing those mistakes, and the other half of that business is cleaning up those,
trying to fix them. Yes.
And I can tell you that from your own personal standpoint, you want to be one of the preventers.
Right.
It's easier, it's cheaper, it's less emotionally taxing than it is to find yourself in the middle of a crisis that you were unprepared for.
Yes.
Now, we're not going to be talking about crises all that much today.
Not today.
But one of those kind of crises is that you have deadlines as you get older.
You do. And John, the number one issue with most seniors, and one of the things that keeps them awake at night frequently, is trying to figure out how they're going to get themselves covered for medical purposes. And how much it's going to cost out of pocket to deal with all the medical issues or prescriptions or therapies or whatever it is that they need. As we get older, our bodies wear out in new and different places, and we need a little more medical care.
That's right. And this is where you get into your open enrollment period, where all of a sudden you have an opportunity. If you're over the age of 65, you've got Medicare, and now you get to decide, do you want to get Medicare Part D prescription drug coverage? Do you want to keep the stuff you have? Do you want traditional Medicare supplemental insurance? Or do you want to switch to a Medicare Advantage plan? And lots of others. Yeah. And it's a mess.
So we thought we'd talk about Medicare issues, because by the time you're viewing this program the first time, we're going to be right smack dab in the middle of open enrollment time for Medicare. So we wanted to talk about that today and give you some tools and some questions that you might want to explore as you are in this open enrollment program. And of course, Medicare is the medical insurance program provided to our citizens if you're age 65 or older, and if you were no longer on an employer-provided medical insurance plan. And so you've paid your Medicare premiums over the years as a working person, and so at age 65 you can go on Medicare. But Medicare, it has a hospital benefit, a physicians and medical equipment benefit, and then it has an elective prescription drug benefit. But Medicare doesn't cover everything. And so lots of folks look into things called Medigap coverage, which is our Medicare supplement coverage. And this time of year, from October 7th to November 15th, is the time to reevaluate all the choices maybe that you made last year to see if you want to continue or if you've had some new and different health issues come up, you definitely need to reevaluate the situation. So, let's start with the first question. Do you go to or keep a Medicare Advantage plan, which is more of a managed care type plan, or do you switch back to or stay on traditional Medicare? Because this is the time of year you can make those changes between those two programs. And John, what has generally been our advice on these things?
I tell you what, in large part our advice is it depends, because lawyers are good at that answer.
Yes, that's a good answer.
But in theory, at least, a Medicare Advantage plan, essentially what it does is it's supposed to be a private insurance that replaces the government-run Medicare. But by law, they're supposed to provide the same amount of coverage, except that the Medicare Advantage plan can offer additional services in addition to what traditional Medicare would buy. So if you're looking at it and you're saying, well, here's two that are the same price or essentially the same price, but this one covers more things, that may seem, that Medicare Advantage may seem like a better deal. Or in many cases, that Medicare Advantage might be a cheaper cost than, say, traditional Medicare with a supplement. And between the cost of the two, that may be more expensive than the Medicare Advantage. So you see a lot of people moving into Medicare Advantage plans, or that they already have Medicare Advantage plans. And I will tell you that for our younger clients, and when I say younger, I'm talking about people who are recently retired, you're 65, 70, 75-year-olds who are very active and in good health. A lot of times these Medicare Advantage plans work very well because they do offer some additional benefits, and typically these folks are not needing a lot of heavy-duty medical care.
Right.
Unless something happens and they get sick and it's a more of an emergency sort of situation, but they might have a heart attack, but otherwise they're just going and getting flu shots and having annual checkups. And for those sort of folks, the Medicare Advantage plans actually work out pretty well. And most of the clients that have those are very happy with them. Right up until they get into those later issues where they start having chronic health problems.
Chronic, or they have a sudden crisis, a fall, a broken hip, those kind of things. And then they find out that Medicare Advantage plan maybe is not going to cover as much rehab as they may prefer. And so a lot of times if you're in got some chronic health conditions that you know of, or you realize that you're seeing your doctor more and more, that might be the time to consider switching back to traditional Medicare if you're on a Advantage plan.
All you have to do, if you're curious about all of this, all you have to do is ask somebody that works in the finance department for a home health agency, a hospice agency, a nursing home, or a rehab type facility, and ask them what their opinion of Medicare Advantage plans are. And if they don't hit you or run screaming, I would be surprised.
That's right.
Because they absolutely hate them because they provide very little coverage. And it seems to me, and I've got nothing absolutely but personal experience to back this up, but it seems to me that basically the way those Medicare Advantage plans are able to provide low-cost services to the healthy, younger retirees is because they nickel and dime the ones that are older and need lots of care. So I think, there's no magic time frame in here, but at some point in time, you probably do want to get out of that Advantage plan, back to traditional Medicare with a supplement, probably cost you a little more, but as you start getting into those chronic health problem years, you're going to be probably better off with that.
So to summarize that, don't let the premium cost or your out-of-pocket cost alone drive a decision about which type of Medicare plan you will choose. So you got to look at the contents of those plans, just not at the cost. So we're going to take our break and we're going to come back and talk about some of the other aspects of open enrollment for Medicare, including prescription drug coverage and some changes we're anticipating. So we'll be right back.
Hi there, I'm Larry Sims. It's been my privilege for the past several years to be a volunteer board member of Hospice of Texarkana, and there I'm able to represent community members like you. We continually customize our end-of-life care to better meet the needs of our community. As an example, our medical director and nurse practitioner still make visits to homes and facilities. Call today to learn more about the help we can give your family. Hospice of Texarkana, the nonprofit hospice established in 1985 for the community, by the community.
The Wadley Senior Clinic has been such a blessing for our family. Because they specialize in geriatric care, they take the time to really focus on Dad's needs. Their exam rooms are specially designed for seniors, and they offer lab and x-ray on site. With monthly educational programs on health and wellness of the mind and body, our healthcare questions get answered. Best of all, they accept Dad's Medicare benefits. See what the Wadley Senior Clinic can do for you. Wadley Senior Clinic, where healthy relationships begin.
Welcome back to Aging Insight, everybody. I'm your host, John Ross, here with Lisa Schulmeyer. And today we're talking about something that if you're over 65, you ought to be thinking about right this very second. And that is all of the issues related to the open enrollment period for Medicare. We already talked about, the traditional Medicare plus a supplement or a Medigap plan versus the Medicare Advantage. And that's one issue. The other issue that we were going to talk about is related to your prescription drugs. And these are covered under those Part D Medicaid plans, and there's lots of parts out there.
Yes, but
there's A, B, C, D, E, F, G, H, I, J, and K. There's all of those, but for the most part, you're either talking about traditional Medicare, Medicare Advantage, which is a Medicare Part C, or you're talking about Medicare Part D. Those others are pretty obscure, and you don't get into those very much.
So, Part D of Medicare is a prescription drug plan. It's one of the newer benefit programs that's offered through Medicare. And, many of you may have lived your life by the adage of, if it ain't broke, don't try to fix it. But this is not the time to apply that adage to your life. If you were happy with your prescription drug plan in 2015, that doesn't mean you'll be happy with that very same plan in 2016. That is because, first of all, we are expecting premiums to rise on average, 12%. But additionally, the formularies on these plans, even if you keep the same plan, the list of drugs, the generics versus the brand name drugs, that formulary can change on the same plan that you're on. And we've had issues every January where someone goes to the pharmacy to get their prescriptions filled for the month, and they find out that their prescription is no longer covered as part of their Part D plan, and they are asked to switch to a similar drug. So, a lot of seniors just don't want to confront and deal with, investigating all this, and I certainly understand, but you will do yourself a favor by investigating the Part D plan that you have now and what changes are anticipated, and then determine if there might be another plan out there that will better fit your need. And this is just something you're just going to have to resign yourself to do every year during open enrollment. Your medical situation may change. You may be prescribed new and different medications. And of course, the plans and the premiums change from year to year. So don't just plan to find a plan that fits for 1 year and just stick to it forever and ever. If you do that, you're probably going to end up paying a lot more than you could, and you may end up being unhappy and get some nasty surprises in the new year when you find out the drugs you prefer and that your doctor prefers are not covered.
Yeah, and they can switch this, every year. So, you know, if, for example, I take 2 different pills, I take them every day, I'll probably still be taking 2 pills every single day when I'm 65. And so I'm going to be searching out a Part D prescription drug plan. And on the one hand, I'm going to look at the actual cost of the insurance itself. But let's say that there's 2 that cost about the same. Maybe one of them's a little bit cheaper, and I might think, well, you know what, I'm going to just go with the cheaper one. But if that cheaper one doesn't cover those 2 pills I got to take every day, then that one is actually going to cost me a whole lot more, because the first time I show up at the pharmacy, they're not going to take me. The other thing they can change about this is not the drugs, but the pharmacy. And they can decide that they don't like your pharmacy, and that they're not going to deal with that pharmacy. And so maybe they still cover your drug, but the only way you can get it is by driving to a pharmacy in Shreveport,
or getting online and ordering
or getting it
mail order.
online, all of which does not work for you. So you want to be sure and have your medication list, the stuff that you take, and have that policy, and start double checking, going back and forth, and making sure that what you're looking for is what's covered. And then you can start price shopping the actual plans. If you end up with 2 that both cover the same things, and they're the same things that you need, then you can deal with which one is the cheaper and which one is the better.
Yeah, so and I know this can be so complicated, and we talked on a prior episode about there's a benefits counselor through the Area Agency on Aging that if you'll bring your medication list, they have a computer program. They can plug in your medications, and it will pop up with all of the Part D prescription programs that cover your medications and the various costs, co-pays, and special requirements. So take advantage of that.
That's right. And if you're new to all of this, this is your first year or your second year, you know, if you're 65, you might be thinking, well, you know what, John, I don't really take any medicines. And, you know, I looked back last year, and the whole prescriptions I had for the whole year, I paid $50 for all the prescription drugs I needed for the whole year. So what in the world would I spend $100 a month for this prescription drug plan when I don't spend $50 a year getting prescription drugs? Well, unfortunately, if you don't sign up for Part D, and then at some point in time in a few years you do, they're gonna penalize you. In fact, every year that you go by without having a Part D coverage, when you eventually get that Part D coverage, they're gonna hit you with a penalty that it'll increase the cost. So if that drug coverage costs $100 a month today, and you don't get it for another 5 years, it may cost you $150 or $200 a month when you do get it.
And that sticks with you for the rest of your life.
That's right, and it sticks with you forever from that point on. So even if you don't think you need prescription drug coverage, you want to be very careful about whether or not you forego it completely, because there are some stiff penalties if you decide you do need it in the future. So anyway, we got a couple other things we need to talk about in all of this, but we got to take one more break. So stick around, we'll be right back.
As things get older, they require more care. This car and I have seen a lot of miles together, but because I take care of her, she runs just like she did in 1955. That's why I chose the Wadley Senior Clinic, with an individualized care plan designed just for me and a convenient location off Jefferson Avenue. They have everything to keep me running like new. It's not about the miles, it's about the journey. Let the Wadley Senior Clinic keep you happy, healthy, and cruising down the road of life.
Hi there, I'm Larry Sims. It's been my privilege for the past several years to be a volunteer board member of Hospice of Texarkana. And there I'm able to represent community members like you. We continually customize our end-of-life care to better meet the needs of our community. As an example, our medical director and nurse practitioner still make visits to homes and facilities. Call today to learn more about the help we can give your family. Hospice of Texarkana, the nonprofit hospice established in 1985 for the community by the community.
Welcome back, everyone, to Aging Insight. I'm Lisa Scholmeyer here with John Ross. And, today we're talking about some of those complexities of getting older. And one of those complexities, it looks to be like every year you're going to need to reevaluate your insurance coverage. Even though you're Medicare qualified, you're going to need to take a new look every year at that coverage to make sure that what you have in place meets your needs, is economical for you, and it's just something you're just going to have to do. And in our last segment, we were talking about prescription drug coverage, and John, I was looking and it said the average cost of prescription drug coverage is running about $40 a month.
I think that's right.
And so, and you talked about, there can be a penalty if you don't get some sort of coverage. There is so long, if you still continue to have employer provided insurance, a lot of folks are working past age 65, but if you still stay on your employer provided health insurance and which has a prescription program, as long as that prescription program offers the same level of benefit as Part D coverages, then you're okay. But as soon as you retire or that program's not available, you better jump on the Part D coverage.
That's right. In fact, when you do stop, if you've quit working and you drop that company-sponsored insurance, they actually should supply you with a letter that says that for the past few years, since age 65, you were covered under a plan that meets all of the definitions for a Medicare Part D, because you're going to need that letter when you apply for Part D. The other thing is, this still does not apply to everybody, because some folks have things like, for example, TRICARE, which is the military retirement health insurance program, and it includes medication coverage, which is far superior to anything you're going to get out on the private market. And so if you receive TRICARE, you don't need Part D for most people. That insurance is going to cover everything, and you're not going to lose it. As a retired military person, you're going to have that forever, and so there's no need for Part D coverage. Same thing with certain federal government workers that have, and even some private employers. I gave this speech the other day, and somebody retired from Lockheed Martin, and their retirement health insurance plan is one of these gold-plated ones that has great health insurance and covers all your prescription drugs, and that person certainly doesn't need Part D coverage at this point. So it doesn't apply exactly to everybody. But Lisa's point about making sure you keep looking at this year after year is very important, because, for example, you may really like your doctor, and while you may have the exact same health insurance plan, it's always possible that that health insurance plan has decided that they don't like your doctor. And all of a sudden, one year your doctor is in the network, the next year your doctor's out of the network. And if you're not looking at that and paying attention to it, when you show back up at that doctor's office in January, you may find out that they're not covered, and that your insurance is no longer going to pay for that, and now you're having to go find a new doctor. And one of the things you can find out real fast is that when it comes to Medicare, a lot of the doctors are not taking new patients if they're covered by Medicare. They'll take private insurance patients, but they don't want any more Medicare patients. So if you have a doctor that you like and you want to keep, you better make sure that your insurance company is going to pay for that doctor, because if they don't and you don't switch to one that does, not only may you find that you can't go to that doctor, but you may find it very difficult to find any doctor at all that will accept a new Medicare patient. Unfortunately, that's just kind of how we have lots of people who have health insurance, but they don't actually have access to the care because the providers, the doctors themselves, won't take certain types of insurance, Medicare being a big one.
Well, and frankly, John, that whole situation can also apply if maybe you get out of sorts with your doctor and you think to yourself, well, I'll just quit this doctor because I didn't like what he said. He told me to not eat so bad or,
Right.
or quit smoking, and I'm going to go find some other doctor. Be careful before you quit your doctor, because you may not be able to get on in another practice. The environment is just much different than it was 25 years ago, where doctors were always open and ready and accepting of any new patients or customers, and it's just not that way anymore.
That's right. Well, like Lisa said earlier, you really are going to need some advice going through this process and looking at your Medicare insurance year after year. You're not going to need it just this once. You're going to need it this year. You're going to need it again next year and the year after that. And so you're going to need some advice. And to be perfectly honest, we're not the place for that advice.
Right. No, we're just raising the alarm. We're
just
letting
raising the
you
alarm.
know.
That's right. But there are some great resources out there. The Area Agency on Aging on both the Texas and the Arkansas side both have area agencies on aging that both have benefit counselors that do take appointments where they can go over these different policies with you. There are some very good private insurance agents in town, but there are also some bad ones. And that is something that we could probably help you, point you in the right direction on some good folks to call, some bad folks to call. And we can also give you the contact information for your government resources like the Area Agency on Aging. We have a community services guide that you can pick up at our office over at 1820 Galleria Oaks, or by giving us a call at 903-223-5653. We'd be more than happy to give you one of our community resource guides so that you can get that information. Of course, if you're looking for information, there's lots of places to get it. Keep watching this. Pick up a copy of our Aging Insight magazine, or you might even just tune in to FM 98.5 at noon on Saturday, where you can listen to us live. And if you've got a question, all you got to do is call us, and we'll answer it right there live on the radio. So lots of ways to get information, and one of the best ones is just keep watching this show, because next week there'll be another. We'll see you then.
Bye-bye.
Thank you for joining us for this week's Aging Insight program with John Ross and Lisa Schollmeyer. This program is made possible by